The right shoes can take an outfit from good to great. Allbirds elevate your everyday style with timeless comfort and supreme versatility. Like their all-new Courier, a shoe with nods to a classic silhouette for undeniable appeal and made from 100% organic cotton. The Allbirds Courier is a natural classic shoe that keeps up with each step you take throughout your day and night. And at the Allbirds Innovation Lab, they're doing all the sciencey stuff like research and testing to create shoes from natural, sustainable materials. So you can look good while doing good. Everyday comfort delivered. Allbirds all-new Courier. Elevate your supernatural style at allbirds.com today and use code SOCKSTYLE for free socks with your purchase. That's ALLBIRDS.com, code SOCKSTYLE.
The right shoes can take an outfit from good to great. Like Allbirds all-new Courier, a shoe with a classic silhouette for everyday style, timeless comfort, and supreme versatility. And at the Allbirds Innovation Lab, they're doing all the sciencey stuff like research and testing to create shoes from natural, sustainable materials. So you can look good while doing good. Everyday comfort delivered. Allbirds all-new Courier. Elevate your supernatural style at allbirds.com today and use code FRESHSOCKS for free socks with your purchase.
Welcome to Handle with Care, Breast Cancer and Beyond, a safe place where both women and men can come and listen to real people talk about their breast cancer experience and the effects that follow well into survivorship. Hosted by Carrie Madrid, a stage 3 breast cancer survivor and founder of the CARE Project. It's time to Handle with Care.
Hey everyone, it's Carrie Madrid, your host of Handle with Care. Today's episode, I'm talking to licensed clinical social worker and daughter of a 2-time breast cancer champ, Rachel Addo. Rachel has been my friend for over 35 years, and she has just a wealth of information from mental health and emotional health to just being a caregiver and a support to a breast cancer patient. So sit back and relax, enjoy. Don't forget to subscribe and leave us a rating or review at the end. Thanks. Let's get into it. Hey everyone, this is Carrie Madrid, host of Handle with Care, and I am here with my special guest and 35-year friend, Rachel Addo. Rachel is a licensed clinical social worker, a mom, a wife, a friend, a daughter of a 2-time breast cancer champ, and also, more importantly for me and selfishly for me, a member of our wellness team at the CARE Project. So thank you, Rachel, for joining me. Welcome, welcome.
Thank you for having me. I'm really excited about our time together today.
We could probably chat for hours, but we'll try to hit some points and then come back for another episode if need be. So I wanted Rachel to be one of our guests because there is so much not talked about with breast cancer survivorship and managing survivorship regarding emotional and mental health. And we all know that mental health is thankfully getting a lot of, how do you say, Rachel? Help me with my chemo brain. It's really coming on the forefront, right? Finally.
Yes, I think a lot more, we're seeing a lot more awareness.
Absolutely.
Certainly awareness. And people are actually, I think at this point, being willing to access a lot of services. Right. And they're certainly increasing in the number of services that are available to people.
Right.
So I'm very happy to see that because in the past, there's always been such a great stigma associated Absolutely. With mental health. And so it's really nice to see this transition where we're increasing awareness, accessibility is increasing for folks who maybe in the past didn't have access.
Right.
And so we're just seeing a lot more people actually taking advantage of resources.
I think that in part, just my own experience with my survivor friends is I think the stigma is smudging away, if you will, of seeking, a psychiatrist or psychologist or even just a counselor or life coach to help you sort of talk it out and get through it. I think what a lot of people don't realize with cancer patients, and I'm only going to speak about breast cancer patients because that's all I know as one, is that it's one thing to hear the words you have breast cancer, and that in and of itself can paralyze somebody with fear and anxiety. It can also, in my case, I think it put me into shock, but that shock and that fight or flight just caused me to fight. So I didn't have a breakdown, if you will. I didn't panic. I didn't worry about my hair falling out from chemo. I just said, all right, let's go, right? What are we going to do? So we made my plan within, I want to say 10 to 13 days of getting my diagnosis. I had my mastectomy, went through chemo immediately, probably within 3 or 4 weeks after surgery, and then had a month off of that and did 5 weeks of radiation. It wasn't until the middle of radiation where I think it started to mentally weigh on me, in that I felt completely depleted. I felt like I finally looked like a cancer patient on death's door. And I think the totality of everything just hit me, right? And so when everybody is like, oh, you ring the bell, you're done with active treatment, go home and rest, and then you get home, and it's like taking a newborn home for the first time and that nurse isn't there, right? And you go, oh shit, what now? Right? Mm-hmm. So I found that for me, when everybody else was like, okay, you're good now, Madrid, let's go, like back to normal, that's when I needed someone the most. And everybody was gone per se, right? Mm-hmm. Do you find that with people that that that's kind of common?
I do. Interestingly enough, when folks are in the thick of treatment, as you mentioned, you look like you're really struggling. You've lost your hair, you're tired, you're lethargic. So right. I think people are more inclined to reach out and try and provide support to you because you look like you're really struggling at that point.
Right.
And most of the time, people are more inclined to jump in and provide the support at that time. And so what we find is that once you've gone through the thick of the chemo, the radiation, the mastectomies, the reconstructions and right. such, people think, okay, they're good. Yeah, right. She's got it, he's got it, everything's okay. But they don't realize the emotional turmoil that then comes after. It's kind of like a tidal wave. You are kind of going through the motions as you're going through your treatments, as you're trying to manage the day-to-day of just surviving.
Right.
And then you get through that, and then
it becomes your job.
Yes.
For me, it became my job. Even though, because I work from home, I was able to kind of work when I could see straight, but it really becomes your job just to go to all those appointments, all those treatments. And so it occupies your mind, I think, for a portion, right? And then I call it the fallout when you get through all that. And then it's like, well, crap, now what do I do? Right?
Absolutely.
And they tell you, oh, go home and rest and we'll see you in 6 months. And you go, well, wait a minute, who's checking on me, right? And then your family. And that's a great point that you make, because I never thought about it that way. When you look sick, people are more inclined to go, oh, let me check in on her. Let me see what, he may need. But then when you look better, they just assume everything's all good.
Right. And then we think, okay, by that time, maybe you're in remission.
Right.
So everyone just makes the assumption, okay, they're back to normal, everything. Right. And I mean, honestly, I think our mind wants to get back to the normacy of things. Our mind wants to get us to where, right. okay, they're okay. Right. But honestly, what I found is that that is the most crucial time in a survivor's process.
Yeah.
That they need the most support, because as you mentioned, now they're kind of left up to their own devices. Now their mind is ruminating over, okay, right. what next? Oh, will it come back?
Oh, I have a headache. Is it brain cancer? My back hurts. Is it in my spine? It's like, no, you're getting old and fat, like get out and exercise.
Yes. But I mean, the mind then really has more time because you're not occupied so much with all of the appointments, so you're kind of getting back into the sense of your, the normacy of life. And it just gives your mind a little more time to settle and really process, oh crap, I just went through all of this.
Yeah.
And so I find a lot of people begin to struggle at that point. And again, as someone that is a support to someone with, that is a survivor, it's when they need you the most.
Right.
And I think that is something that doesn't get talked about very much. Like, how do we support after? And, I think we talk about it quite a bit. I know we have, Carrie, talked about the stages of grief.
Yeah.
And honestly, when someone is given the diagnosis of cancer, they often go through those 5 stages of grief. And so, and I'll just talk real quickly about the 5 stages of grief so that you people that are listening may be able to look at and may figure out that in some time in their lifetime, they may have gone, or not their lifetime, but during their dealing with cancer, they may have been through there. But the 5 stages include denial, anger, bargaining, depression, and acceptance. And they're not necessarily where you go through them in order. You may go in one, out another, come back to another. And so
I have the chills right now. Like, I really have the chills because I just wrote that down. And I've never, I mean, I know we've talked a lot about it, but you know me, it goes in one ear, and my chemo brain is really hard for me to retain a lot of information. And that's where some of my frustration comes in with survivorship. That's a whole other episode. But this is really good. Denial, anger, frustration, bargaining, depression, and acceptance. So explain bargaining for me.
So sometimes what you'll see when you have bargaining is someone will say, you know, if I won't necessarily say it in the course of dealing with breast cancer per se, but say you would have a person who says, you know, if you just would take this away from me, then I will exercise more. You know,
kind of like when you're drunk and you say, God, just get me through this.
And I won't drink anymore. I promise you, I will stop drinking if you will just take this hangover away.
Got it.
You know? So you just try to, you know, if you can find some way to kind of get out of this. Now, again, typically these 5 stages are seen in grief. So that's when someone has bereaved or someone has died. But when we are struggling with breast cancer, we grieve maybe the life we could have had. Maybe we grieve now that we found out we have breast cancer. Maybe we can no longer become a mother. We grieve, you know, whatever it is. And
some people really grieve their hair, the loss of their hair.
Their body.
Me, I didn't care. Their breasts, they grieve that. And for me, I didn't care about that. I think it all kind of hit me later, and it still isn't about the hair and the breast for me. And that's just me. But I accept that others feel that way. For some, it was about grieving their femininity because they associated having breasts with their femininity. And so it becomes that they go into that depression, anger, depression, and then eventually we hope at the Care Project, at least, and with your help and our survivor mentors, is to get them to accept themselves where they're at, accept their life where it is. It isn't nobody plans this, right? How do you plan this? Even somebody that might be predispositioned because their genetics, you know, you still don't plan for this. And you can plan all you want. You never know until you go, right? But I think that this is really good, the stages of grief, because that applies to a lot. I'm sorry, I'm just soaking that in for a minute because we talk about that a lot. Let me go back to your experience with your mom. So your mom was first diagnosed when you were in college, right?
That's correct.
What do you remember that day when she called you and had to tell you? I'm sure you do. Chills.
Yeah. It gives me chills as I think about it. She had found a lump and then said, you know, I have to go back in and get a biopsy. Let's not worry about this. I'm sure it's just not a big deal. You know, that's usually the course that we go through. I'm like, oh, okay. No, okay. And I always have seen my mom as this very strong, active, vital lady. And so honestly, and I hang on to every word that she says. She's like always been my best friend. So if she says it's all good, I'm assuming it's going to be all good.
Yeah. And she's a nurse.
Yes. And she's a nurse.
I remember her in her little white uniform with her little white hat when they used to wear them.
Yes.
She was a very calming force, a very strong woman, but also very calming. You have that from her.
Well, I appreciate that. Thank you. So she's always been very strong and just kind of said, you know, I think we're going to be fine.
Yeah.
So I said, okay, Mom, you know, and I kind of took it for what it was worth.
Yeah.
And then she phoned back very hesitantly because she knew that if she called, that I was going to drop everything going on and return home. And
how far away were you at that time?
So we grew up in Southern California, and I was in Northern California at college at UC Davis.
Okay.
And so I got the phone call and I was like, okay, that's fine. I'm coming home. And so she was really conflicted because I am her oldest child, the first one going off to college. She and my parents were very excited about me going off to college. So the thought of me returning home was very daunting. And she felt like if I come home, I won't return back.
Mm-hmm.
And so I said, no, there's really not another option, because if I stay here, it's not going to be very useful, because I won't be able to think. I won't be able to focus.
Right.
I'll spend my time worrying about you. So let me just come home.
Right.
And maybe I can transfer to a local UC.
Right.
And come home and provide you with support, because of course you're going to need rides.
Right.
You're going to need help with cooking and
practical support.
Right. And I had a younger sister that was still home at that
Mm-hmm.
time, and she's 6 years younger than
Right.
I. And so I said, you're going to need help even with her. So
Yeah.
let me just come home. So I did. I transferred to UCR in Southern California, and was able to come home and provide support to my mom for about an entire academic year.
Wow. So how did you feel seeing your mom like undergo chemo? I mean, surgery is one thing, right? But chemo is a whole other beast. And it really transforms your appearance even just for a time, because you're put on so many drugs to help with, like they put you on steroids to keep the inflammation of your organs down, which make you bloated to craziness. You look like a Oompa Loompa, and then there's the losing your hair, and then you lose some color, and then things just change. Some people's fingernails turn black and fall off. So what was that like, watching your mom physically look like she's a beautiful woman, and she's very strong and always been healthy? So how did that affect you, seeing her physically?
It was devastating, honestly.
Yeah.
It was very hard to watch.
Yeah.
And honestly, as you mentioned earlier, even being a survivor, how you just kind of just push yourself through it.
Yeah.
That's kind of how I felt being a caregiver, or
Yeah.
being support to her.
Right.
It was very hard to watch. Honestly, she was always very, like, not necessarily full figured, but she always she's very shapely.
Yeah.
And so she went down to nearly, I think, under 100 pounds. So she lost
Wow.
a ton of weight because she couldn't eat any foods.
Yeah.
And when she did eat something, she didn't like the way it tasted.
Yeah.
She always had that metallic taste in her mouth.
Yeah.
So it was always trying to, push her to eat or give her supplements.
Right.
And then her hair fell out. She's always had a full head
Beautiful
of hair.
hair. Yeah,
Beautiful
absolutely.
Hair. And so it was really hard to watch, because sometimes I didn't recognize her.
Yeah.
As how in my mind I've always seen
that
her.
makes me a little teary, because I wonder what my kids felt. I'm trying to get them on to do maybe you could help me mediate that. I'm trying to get them to do, at least my oldest and my youngest, an interview with me, to have a real candid conversation to see how they felt. And it's interesting that you said that about being away, and I can relate to how your mom must have felt having to call you, because my son was in the Air Force. Mm-hmm. And he had just, he left in 2000, and he graduated high school 2007, left in later that year, and was gone. And 5 years into him being on his own and in the Air Force and just getting stationed somewhere that he wanted to be, I had to tell him through Facebook, because he didn't even have a way, we couldn't text or call or anything. And he had to find a way to get back stationed over here. And I felt horrible guilt, yet I wanted him here, because he was like, my daughter's surrogate father, if you will, being so much older. But then also my only help as a single woman was my son. And so I can imagine how your mom felt, especially when you're off to college. Mm-hmm. But there's always a workaround. You got to go to UCR, you got to provide that support and be there for her and your sister. And so did it change your relationship at all with your mom?
Absolutely.
Mm-hmm.
Absolutely. So as I mentioned earlier, my mom has always been my best friend. We've been very, very close my whole life.
Right.
But it did change my life, and it did change our relationship in the respects of, I began to see her, I guess it humanized her.
Yes.
It did. In my life, she's always just been this superhero,
right.
person that, was just
invincible.
Absolutely. And so it humanized her in so many ways. And it just made me realize that, I had to come to grips with her mortality, my own mortality at some point. But just realizing that she's a human, and that she hurts like anyone else hurts. Yeah. She feels like anyone else feels. Yeah. She gets sick like anyone else gets sick. And just as growing up as kids, you know, your mom never gets sick. Even though they do get sick, they never get sick, because even if they're puking over in the corner, they keep going. I mean, she's sick, you know, her stomach is hurting. You never know, because life as a mom has to continue on. You don't get the luxury of laying in the bed for 3 or 4 days.
Right.
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 So the fact that the breast cancer really laid her out, you know, where she was not able to do basic things for herself.
Right.
It really just made her human for me.
Yeah.
But it also just really made me appreciate her. I already loved her with all of my heart. But this in turn just made me love her even more.
It's like a different level, I think. I think it's a different level. That's really interesting to hear that.
A greater appreciation of her. I mean, I appreciated her before, but then I started thinking like, oh my gosh, now what happens if she does not make it through this?
Right.
How in the world am I going to live my life without this person? Possibly?
Right. And you were college age, right? So still young, but not like some patients that we have, not to minimize, but just to say, and in addition to that, consider those that have younger kids.
Oh gosh.
I mean, mine were still old enough to understand. So I don't have, we have some clients that come through the care project that are in their late 20s and they have a 1 and 2 year old, you know, and I can't even fathom, because if they were to not make it, their child probably won't even have any memories of them. At least my kids, my youngest was in junior high and the middle was in high school. I want to say 7th and 10th grade. It's kind of all a blur. But that was my thought. Was, even though their dad is around, he's not in their day-to-day grind like I am at being divorced. And so I couldn't even fathom. And I wonder what my kids thought. I remember, I'm going to try not to cry. I remember when I had to tell Anthony through Facebook a message. You know, he knew I was going in to get tested and all of that. And he wasn't big on social media. He still is not to this day. In fact, I don't think he's even on there anymore. But he posted a one-liner that ripped my heart out. And it said, please don't die, Mom. I'm not ready to fill your shoes yet. This is a child that helped me raise his sisters when I got divorced. He was 10 years older than Liv. So when he was 12 and she was 2, I was working 2 jobs and I would go.
Judy was boring.
Hello.
Then Judy discovered ChumbaCasino.com.
It's my little escape.
Now Judy's the life of the party.
Oh, baby, mama's bringing home the bacon.
Whoa, take it easy, Judy. The Chumba life is for everybody. So go to ChumbaCasino.com and play over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
From one job to the next, and Anthony would get off the school bus, drop his backpack at home, walk down the street, pick up his baby sister in the stroller, bring her home, lock himself in. My other friend, Cheryl, would pick up my middle child from childcare, take her, drop her to Anthony, make sure they were locked in. I would have cooked earlier, you know, so he bathed them, he fed them, he put them to sleep until I got home at midnight. You know, and I'd come in sometimes and he'd have one baby on his shoulder and one across his lap, and he's 12.
Mm-hmm.
So when he posted that, I'm not ready to fill your shoes yet, I felt horror. I felt guilt, because this kid's already had to do more than his fair share. He's finally away from the 3 females, you know, in the Air Force and going in to get, so he can get free education and become a man, you know, and now this. Right. So we're going to find a way to get Anthony on here so we can talk about that, because I'd love to hear his perspective as a male watching his mom go through that. I think it's really important. But what advice would you give to parents with even younger kids? Like, how much do you tell them? Do you keep it real? Do you not? And I'll tell you after your answer why I'm asking that.
Well, you know, I really think that you do need to have a very difficult conversations with your kids. And I guess it really depends on several things. First of all, their age.
Yeah.
Their cognitive ability.
Yeah.
You know, because their age alone does not determine their ability to, you know, decipher or be able to discern the information you're sharing. But you have to have these conversations, because you will change before their very eyes.
Yes.
And so what often happens is, if you don't have the conversations or kind of provide some insight to what's going on, your kids then will start making things up in their own mind.
Assumptions. Yeah.
Assumptions, or what's going on, or just in general, if you just think about your own life, when you don't have all the details of what's going on, then your mind,
you go everywhere. Yeah.
Your mind then starts
That's a good
deciding,
point.
Okay, well, I'm sure it's this, or I'm sure it's that, or you begin to think you start making things up.
Yeah.
And they're not always accurate.
Right.
So what I would suggest is, with support, I think it's important if you have really supportive people in your life or people that can help you.
Right.
Having conversations. Hey, this is what we're going through. This is what we're faced with. And it doesn't have to be all the details and all the gore,
Right.
but just enough that you can give the basic details so your kids can have some expectations or understand what is going to come forward. Because
Right.
of course you don't always know.
Right.
The other thing is, I always say, if your kids ask, they already have some ideas about what's going on, or they have some feelings or some thoughts. So if they're asking, it's very important that you share what they're asking.
Honestly with them. Yeah.
Honestly, because
and honestly doesn't have to be, like you said, all the gore. Right.
Yeah.
It just, you need to be very honest with them and let them know. I think it's really important because I've seen some teens that have gone on to lose their parents and now they're really struggling and they feel, obviously they're grieving and all that comes with that, but they also feel betrayed in a way because they weren't given enough information when, mom or dad knew that they had a small amount of time left. They didn't give that child the opportunity to say or ask or process or work through it. And if they don't know that mom or dad's okay with, hey, this is happening and I'm at peace with it. I'm not happy about it, but I've made peace with it. It doesn't lend itself to them. And the other thing is, I know for me, trying to keep there as moms in particular, and I'm sure this applies to dads also, as parents, we want to keep their lives as normal as possible, right? So my daughter was playing basketball. I'm still trying to run snack bar. Still going to I was crazy. I was in every gym. My friend, who was one of my best friends, Coach Leonard, would literally help me out of the car, and I'd limp into the gym and he'd plant me in the bleachers next to some other parents and say, watch her and don't let her leave and don't let her get hit with the ball. And it just was my way of coping. It was my outlet. I tried to keep their life as normal as possible. And with that, I still was trying to do dishes. I still was trying to cook. I still was trying to do their hair, like all those things that I had no business trying to do. And I could kick myself because in the end, I would be annoyed with them. Like, don't you see me over here, like struggling? And why do I have to ask you to take the trash out? But that's on me because I didn't keep it real with them. They knew what I was facing, but they didn't know how I was feeling. And I think it's really important because, like you said, watching your mom, they just think you're invincible, right? And then it hits, but I didn't ever let them see me like that.
Well, and I think it's important for them to know. And then also giving them some responsibility. For example, in your case, the girls learning to do their hair.
Right.
What happens if you don't make it?
Right.
How do they learn these skills?
Right.
And so I think that was kind of your way of coping with, okay, I do need to keep some level of normacy.
Right.
But it's a very fine line to walk.
Yeah.
To try and make sure that you have some balance in that.
Yeah.
If there's also a time where then you have to make sure that, hey, if for some reason this does not work out the way we'd like for this to, and, I do not make it through this, I need to make sure you're able to take care of these things for yourselves.
Right.
And of course, that's because you had older kids at that time.
Right.
But again, it's really hard because when you're going through this, you want to protect them. You're their mom.
Yeah, for sure. That's number one. But also I found myself in the middle of, how do you say it? Just everyday tasks, right? And I would be, maybe blowing out Olivia's hair or something. And I would say to myself, oh my gosh, what if I'm not able to do this? What if I'm not here next year? Like, this might be my last time. I'll never complain about doing their hair again because I want to be able to do, so you tell yourself that, and it's right. And I wish I had had someone there to just say, hey, stop and think about this and consider this. But you're just in the moment. So you do the best you know how to do, which is why we want to do this podcast, so that not only do patients get gain some perspective from others who've been there, done that, but they also hear professionals like yourself, and not just a professional, but someone who's literally been a caregiver and a daughter of, a breast cancer patient, and you watched me and supported me through mine. And I'm sure you have other friends as well, So how does it play on you and your sister, like knowing mom was diagnosed? Did that just cause you to maybe, you're in great shape and you take good care of yourself, but did it make you paranoid? Do you worry about it? Like, how do you deal with that?
Well, it did increase our vigilance with making sure we were getting mammograms, but when, like, as you mentioned earlier, when we started this, that my mom has had breast cancer twice.
Mm-hmm.
So she had it when I was in college, and then almost 20 years to the date, she had a second reoccurrence.
Right.
And when it came the first time, because I think we were kind of in the earlier stages, that's well over 20 now, probably 27 years ago.
Right.
With her first occurrence, lots of technology has changed.
Right.
We've got lots more insight on,
so many advances.
Yes.
Yeah.
Genetic testing and all of that. So when she had her second occurrence of breast cancer, then it really became like, oh my goodness, this is really scary. Not that it wasn't scary the first time, but oh crap, we're really having to deal with this a second time.
Right.
And so at that point, my sister and I were already vigilant about making sure we were having regular mammograms, doing monthly breast checks.
Right.
In fact, after my mom's initial fight with breast cancer, I became really interested in sharing. I'm a part of a sorority, Zeta Phi Beta Sorority Incorporated, and I would make sure that we would give pamphlets out on monthly breast checks to make sure that people were able to, women were able to learn how to do certain things for themselves. Checking their breasts monthly, making sure they took their mammograms. So the things that I was learning, I was trying to impart to other people, because I just didn't want someone to miss something that's just as simple as checking your breasts in the shower. So my sister and I became very vigilant about making sure we did our yearly mammograms, which we were able to start earlier, because our mom is a breast cancer survivor, and then also making sure we're doing our monthly checks, but just really being vigilant, and then trying not to panic when anything came up, because that then also starts making you think like, oh my goodness, I feel something. Okay, do I have it too? Or just in general, any type of issue that comes up. I think
once you're more aware, you can never unhear it, right? Which you just cannot, because I know exactly what you mean by you feel this sense of urgency to share with others, not just to take care of yourself, but to share with others. Because once you know, you can't unlearn it. You can't unhear it. And that's one of the reasons why with the CARE Project, I talk a lot about male breast cancer, because nobody talks about it. It's getting more and more action, so to speak, which is fantastic. But it's really important, I think, for us to not only teach our daughters, but to also just make our boys aware that, you're not exempt.
Yes.
Just because it doesn't run in your family, just because you're not female, whatever the case may be, we just need to end the stigma and the over-sexualization of breasts in general. And men need to know that, you don't just have a chest, you actually do have breast tissue.
You do.
We all have breast tissue. We all can get breast cancer. So I think it's really important to keep sharing that message. Let me ask you this. When I asked you to be involved with the CARE Project, one of my big, bright ideas, the way in which I asked for you to help was, we have survivor mentors that have been there, done that I try to link up with newly diagnosed or whatnot. And so you helped us conduct a workshop to sort of give some guidelines about what to say, what not to say, different perspectives. You gave us emergency numbers for mental health, because there are some that end up in such a deep depression that I know some personally who have been suicidal. I have not been suicidal, but I have seriously questioned why I lived through everything I did to then endure something else, or to struggle with the quality of life, because my body's never been the same. And I'm not talking what it looks like physically. I'm talking about, or aesthetically, but I'm talking about physically. My strength is so different. And that's a grieving process for me. There's been times where I just thought, why am I still here? But When we did that workshop, we spent probably the first hour just going around the table with the mentors, and you kind of heard a little of their story, and that was totally unscripted. But what did you take away from that? Like, what do you think is the most common emotional issue for us?
Well, there are a few different things. When a person is, now, because your mentors are all folks that have already
Right.
have had their battle, and now they're in a position where they're able to provide support back to
Right.
others. And so one thing is that I always tell you this, and I always say the Q-tip.
Oh, Q-tip.
Yes.
That has saved my life. From my work life to my personal life, everything, Q-tip.
Yeah, so quit taking it personal, because one thing I did know is that, I mean, and you can recall, I'm sure, it's interesting because when you first go through your treatment, everyone wants to help, everyone's calling, hey, what do you need help with? And then of course we know that that kind of tapers off as time progresses. And sometimes when you're in the initial stages of things, you sometimes just don't feel like talking with people. You would just rather rest, or you just would rather kind of sit there and just try and process what's going on around you.
Right.
And people are calling like, are you okay? And then you just don't want to talk.
Yeah.
And so one thing I think it's really important is I didn't want them to take it personal. If they're reaching out to their mentee, and their mentee's not responding, as quickly as we'd like, or as regularly as we'd like, be aware that we can't always take it personal.
Right. And to let them just have their space and their time. Yeah.
Have their space and their time. But the other thing is that, so we don't want them to take it personal, but then there's again, a fine line to walk with that.
Right.
Because we do know that some people get into deep depression.
Yes.
And we don't want to leave them out there where they're not getting the support and they really are struggling. So it was to make sure that they could be available, but then also give people space. So don't take it personal. Right. Another thing I always remind people, and not even just mentors, but just someone from the outside, is us being overly positive about what you're experiencing.
Yes.
I think people are inclined to say, oh, it's going to be okay. You're going to get through this.
Yeah. Well, you'll be fine. You'll be fine.
You're going to be fine. You're going to be fine. And the reality is, with cancer, honestly, we don't know the outcome.
Right. Right.
What I say is, please just listen. Just be willing to listen. Be an ear. You don't have to have the answers.
That's important. You don't have to have the answers. Yeah. Sometimes people just need to talk it through. Even when I have like ideas about, oh, I want to do this or that. Sometimes I just like, hey, I got to call you. Can you, I got to talk to you. And then I just, blah, 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 you know how I do. I just run my mouth and I think it over. And then I hear, well, what about this? Okay, great. That's all I needed. I just needed to talk it through. And I think sometimes that's what patients need as well. So I think that's great advice. I think, it's not all rainbows and sunshine and pink ribbons and solidarity. It's a lot of bullshit. It's a lot of stress. It's a lot of pain, and beautiful things can come out of that. But in that moment, that person may not be there. So I think that is really important. We have a new book out called Handle with Care, Your Breast Cancer Support Group in a book. So this book was co-authored by myself and Margaret Lesh, who's a 2-time survivor and an accomplished author. And she took the time and donated her time to interview 10 other survivors and gain their perspectives on various topics. So a lot of the times we're asked, hey, my friend was just diagnosed, my sister, my cousin, my friend's sister, whomever was just diagnosed. What can I get them? I want to send them something. Well, I'll tell you, when I was diagnosed, I got everything pink, and I hate the color pink. I got everything, big, huge novels. Like, everybody was so well-intentioned, but I was just like, okay, one, I can't see straight from chemo, and I'm not reading a novel right now. So what we wanted to do was create this small handbook where someone could flip to a chapter because they're getting ready to have chemotherapy or radiation or reconstruction, and hear from those of us in the hive. It's called the Care Project with Wisdom from the Hive Mind. So the hive is the survivors, and we did include Brett Miller, who's a male survivor. So this book is great. You can get it on Amazon. It's available paperback and Kindle. But it was really important to us that we have a whole section in here on what to say and what not to say to someone. So this book is not just for the patient, it's for the family members, it's for the friends, it's for the caregivers. So thank you for talking about that. We've got to go, but we'll have you back, because I really want to do sort of a panel discussion with maybe one or two other survivors, and let's talk more about ending this stigma of seeking help, because a lot of people go into this depression following, when people think you're supposed to be elated because you're done and you go back. It's really, just to reiterate what we've already said, it's really the most crucial time to provide the support. So if your friend goes radio silent on you, that's your cue that you need to check on them. Because I have had patients who also have had reoccurrences. 1 year later, 5 years later, 10 years, 20 years, it seems to come in those weird increments of time where just when you think and I'm speaking as a survivor, just when I think, okay, I made 5 years, like I'm good, I can kind of chill on that, right? And then, for instance, later today, I've got to go get blood work for my next oncology follow-up. And until I get that cancer marker test back that says everything's normal, I kind of have to talk myself down and go through those tips and all the coping mechanisms you've given me in the past to just breathe through it and get through it. And I think we need to talk about that. I think that's a whole other show.
Well, I think they call you a survivor for a reason. I don't think there's ever an end, because you're always having to overcome this process, because as you mentioned, your body is not the same.
Yeah.
There are lots of side effects that people suffer after having chemotherapy, like the neuropathy, the strength, the lymphedema stuff. Yeah. So you continue to live through this process.
You manage it. You really manage survivorship.
Well, and just before we leave, there are just a couple of tidbits that I think are really important to people supporting. As I mentioned earlier, I think we discussed, of course, not taking anything personal if they, are not wanting to talk about things. But one other issue I think we should just make sure you listen. And the other is educate yourself.
Yes.
If you are supporting someone who is managing breast cancer survivorship or in the thick of it all, you should educate yourself. So educate yourself so that you understand as best as you can. You don't necessarily understand everything they're going through, but understand maybe why their taste has changed. Understand maybe why they're so tired, the side effects that they may be going through, because I think it will allow you also to give them a little more grace and understanding maybe why they're a little bit more irritable today than they were yesterday.
Yeah.
And so being educated and just truly understanding the disease process or how it may impact their emotional well-being, their physical well-being, really will help you be a better support to them.
So I think that's great advice. We actually are going to have these books available in our office. You can visit our website, thecareprojectinc.org, and hit that Contact Us tab. It'll send, actually, I get those emails directly. You can go on Amazon and order the book. If you need a book for someone newly diagnosed, you can't afford the book, or you're just not in a position at this moment, call me at the office, 951-742-7405, and we will send these books out. I'm waiting on my bulk order to arrive now. So thank you so much. Like I said, we could talk for hours, but we will have you back and talk more about this, because I think this is super, super important on so many levels, So thank you so much for your time. And thank you for supporting me. You were the perfect friend during my treatment, from showing up with that new Joe CD and the shea butter, like you came with practical stuff. For me, music is therapy, and bringing me music and comfort items and just your calm demeanor is such a blessing. So keep doing what you do. Thank you for being part of our wellness team, and I'll talk to you soon.
Thank you so much. Thanks for the opportunity. I love you.
Absolutely. Love you too. Talk to you later.
Bye-bye.
Bye.
Thank you for listening to Handle with Care, Breast Cancer and Beyond. Please let us know what you think of the show by leaving a rating and review. And don't forget to share it with a friend. For more information or to connect with Carrie, go to thecareprojectinc.org.
Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Ah, sorry, we were looking for Chumba Casino. That's right, ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
With the Lucky Land Slots, you can get lucky just about anywhere.
This is your captain speaking. We've got clear runway and the weather's fine, but we're just going to circle up here a while and get lucky. No, nothing like that. It's just these cash prizes add up quick. So I suggest you sit back, keep your tray table upright, and start getting lucky.
Play for free at LuckyLandSlots.com. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.